Hi, Dr. Marco in class. My practicum project is the use of telenursing tools on the virtual urgent care platform. So, why is there a need for telenursing? Use of the virtual urgent care application can improve access to care, improve health equity in vulnerable populations, provide convenience by saving travel time, avoid wait times, and improve satisfaction. Nurses are essential for providing the education for patients to enhance their own healthcare. If patients have the option to connect with nurses on the virtual urgent care platform, then there can be improvement in patient education, preventative care, and patient outcomes. What are the benefits of telehealth? Virtual urgent care platforms provide rapid access care for patients with low risk clinical conditions through digital technology. It provides many benefits such as eliminating travel time, decreasing wait times, lower costs, higher patient satisfaction compared to urgent care centers and emergency rooms. With the reduction in wait times, costs for healthcare institutions also decrease. Telenursing on the virtual urgent care platform will allow nurses to assess patient needs and symptoms, prioritize urgency of patient needs, provide instructions and education for patients, and evaluate patient outcomes. It will improve patient outcomes and patient satisfaction by providing education, delivering patient results, recommending referrals for other services, and symptom triage. These are the best practices identified. Number one, the implementation of technology in healthcare practice includes clinical decision support tools, electronic patient portals, telehealth, and electronic health records. The clinical decision support tools include notifications, alerts, reminders, clinical guidelines, order sets, and documentation templates that provide patient specific information to enhance decision for healthcare providers. The electronic patient portals used by patients at the organization is MyChart, which allows for access to medical information and communication with their healthcare team. Telehealth provides virtual visits with a healthcare provider for non-emergency conditions. Electronic health records, also known as EHRs, provide clinicians with complete access to patients' health information. Best practice number two is improvement in patient satisfaction, which includes easy access to scheduling patient appointments, having internet access for health information, providing access to on-demand care and treatment for non-emergency conditions, and providing electronic tools for patients to communicate with their providers. The MyChart portal allows patients to schedule appointments, have access to after visit summaries, the option to use the NYU virtual urgent care, and patient provider communication. The third best practice is improving patient outcomes, which includes complete and accurate documentation in electronic health records. The use of electronic health records provide clinicians with complete access to medical records, the continuity of care for patients, and the coordination of treatment plans with all providers. Implementing policies for complete documentation in Epic, the policies for communication between the healthcare team in Epic, and policies for performing patient discharge phone calls improves patient outcomes. The project plan is to implement electronic telenursing tools on the virtual urgent care platform to allow patients to have access to nursing care and health services. This project will be implemented at NYU's virtual urgent care with nurses trained in telenursing. It will serve patients that need the virtual urgent care services. An educational program consisting of a protocol, guidelines, and tip sheet will be created to train nurses on the use of telenursing tools on the virtual urgent care platform. Nurses are expected to complete all training before providing telenursing services to patients. Evaluation resources include a post and a pre-assessment survey that will be given to nurses to complete before and after training to evaluate the knowledge with the use of the platform. A satisfaction survey will be given to patients to complete, which assesses the satisfaction scores with telenursing service. Resources for application support will be available for nurses after the implementation. And a completion report will outline the project performance, deliverables, outcomes, and recommendations for telehealth requirements. The SMART objective for the project proposal is to incorporate telenursing tools and services in collaboration with physician-based appointments on the virtual urgent care platform to reduce emergency department crowding below 85% within 12 months. This objective aligns with the hospital's goals of providing high quality and safe patient care. The second SMART objective for the project proposal is to obtain an average patient satisfaction score above 90% for the use of virtual urgent care platforms for physician and nursing care within 12 months. This objective aligns with the hospital's goal of providing patient care, centered care to improve patient satisfaction. The third SMART objective for the project is to implement guidelines for documentation in telehealth to improve patient outcomes within a 12-month period. And this objective aligns with the hospital's goal of providing patient-centered, high-quality, and safe care. The mission of NYU Langone Hospital is to serve, teach, and discover. The vision at NYU Langone Hospital is to make world-class contributions that place service to human health at the center of an academic culture devoted to excellence in research, patient care, and education. The top priorities at the organization include providing patient-centered care, stimulating research, and providing education. And this project aligns with the organization's mission, vision, and priorities with improvement in patient-centered care and advancements in technology. Issues faced by the organization for improvement include gaps in technology access, data accuracy, patient privacy, patient confidentiality, clinician resistance to change, and improvement in documentation for nurses. The stakeholders that are involved in the project consist of nurses, nursing education department, quality improvement department, information technology department, and the patients. The nurses will be the end users of the project. Nursing input and opinions are needed for development of electronic telenursing tools to improve care provided to patients in a virtual environment. The nursing education department will develop content and policies for the education program and training. The quality improvement department monitors processes and analyzes performance to ensure that the project is improving quality of healthcare. The information technology department will develop the electronic template for telenursing assessment and tools on the virtual urgent care platform. And they will also provide support and ensure nurses have access to all components needed for the telenursing service. The project will be implemented to serve patients that need virtual urgent care services. Patient service surveys will provide data that will help to improve virtual services, patient satisfaction scores, and make the platform user-friendly. The first task for implementation of the protocol for the use of telenursing into healthcare practice is identification of the telenursing tools needed. This involves actions by the project manager and nurse educator. Then the project manager, informatics nurse specialist, and Epic specialist will create the telenursing tools with virtual urgent care platform. Next, the project manager, informatics nurse specialist, and Epic specialist will implement and test the telenursing tools. Finally, the project manager, nurse educator, and informatics nurse specialist will develop the protocol and tip sheet for appropriate use of telenursing tools. In regards to implementing on-demand nursing services and electronic tools to improve patient satisfaction scores, first task is to research current virtual urgent care patient satisfaction scores by the project manager. Then the project manager and quality nurse specialists will identify areas that need improvement. Next, the project manager, informatics nurse specialist, and Epic specialist will implement the telenursing tools to improve patient satisfaction scores and communication. Finally, the project manager, quality nurse specialist, and nurse manager will evaluate and assess patient satisfaction scores post-implementation of telenursing services. And finally, the first task for implementing guidelines to improve documentation in electronic health records and telehealth is to research current documentation protocols in the electronic health record by the project manager. The project manager and quality nurse specialist will then identify areas that need improvement. Next, the project manager, informatics nurse specialist, and EPIC specialist will implement the appropriate guidelines for documentation for telenursing. Finally, the project manager, quality nurse specialist, and nurse manager will evaluate and assess the patient outcomes. The metrics that will determine success include the effective use of telenursing tools on the virtual urgent care platform measurements tool for following protocol, the patient satisfaction surveys, and the chart audits for complete telehealth documentation. Implementation of telenursing tools on virtual urgent care platform allows nurses to assess patient needs and symptoms, prioritize urgency of patient needs, provide instructions and education for patients, and evaluate patient outcomes. This results in improvement of patient care, patient outcomes, patient education, and healthcare management, cost effectiveness of healthcare services, and increases patient satisfaction. And this project is a means for improvement in patient-centered care and advancements in technology, which upholds the mission, vision, and priorities of the organization. And currently at the organization, there is a lack of telenursing services offered for patients. With implementation of telenursing tools on the virtual urgent care platform, nurses will be able to assess patient needs and symptoms, prioritize urgency of patient needs and care, provide instructions and education for patients, and evaluate patient outcomes. To sum up, the purpose of the project proposal is to implement an educational program for nurses on the proper use of telenursing tools. And it will include the development of a protocol, tip sheet, and guidelines on appropriate use and documentation of telenursing. And resources for the application support will be available for nurses after implementation. And this project is a means for improvement in patient-centered care and advancements in technology, which aligns with the organization's missions and vision. I appreciate the time you have taken to view my presentation. Any feedback and questions are appreciated. Thank you.